ECG. Okay, so when we talk about the 12-lead ECG, okay, there are actually 12 of these leads. Okay, there are only 10, but it gives you 12 different views of the heart. That's why we say it's a 12-lead ECG. Okay, now you have, of course, on the upper extremities, the right and left, and then on the lower extremities. Now, one thing you need to remember when you apply these electrodes, especially on the extremities, avoid bony prominences. Okay, meaning you cannot put it on the actual bone. Now, commonly we put it on the inner aspect of the forearm. Okay, but if, for example, you have a patient, no arm, no right arm, so you can put it here by the biceps. But if, let's say, this patient only lost one arm, if you put it on the biceps, on the other side, it should be on the same area. So you can't have one here, and then the left arm will be on the forearm. So arm, both, like I said, avoiding the bony prominences. Now for the lower extremities, you usually put it on the medial aspect of the leg, or you can put it on the thigh, or let's say amputee, on the abdomen, lower aspect. Again, no bony prominences. So you have here these different areas. Okay. Now, when you're talking about the chest leads, okay, so you have V1 to V6 chest leads. You have 6. Okay. Now your landmark for you to know where to apply the different leads, okay, will be, take a deep breath. Okay, this is the sternal notch. Feel downwards. You will feel a small ridge. Slowly, Richard, because it's going to be up here. Okay. The sternal angle. Okay. You'll feel a small ridge. That's too low. Okay. It's too low. Like I said, feel your sternal notch. Go palpate downwards just a little. You will feel a small bump, a small ridge. That's what we call the sternal angle, and that's the angle of Louis. Who is Louis?
Mr. Louis is here.
Okay. The angle of Louis, L-O-U-I-S. Okay. Okay, the angle of Louis. Not make any comments anymore. It's like, okay. So, that angle of Louis corresponds to the second rib. Okay. So, you start counting now. So, from the second rib, okay, you'll feel a space. So, that's the second ICS, intercostal space. The third, or then you move your finger lower, that will be the third rib. Below the third rib will be the third intercostal space. Below the third intercostal space will be the fourth rib. And below the fourth rib will be the fourth intercostal space, which is the site of V1. So V1 is located at the fourth intercostal space, right sternal border here. Okay. And then you have you have V2, which is right across it. So this is at the fourth intercostal space, left sternal border. Okay. Now let's skip V3. Let's go first to V4. V4 will be located at the fifth ICS, left mid-clavicular line. How do you know it's the mid-clavicular line? Just follow the nipple line. Just below the nipple will be the area of the of V4. That's the fifth ICS, left mid-clavicular line. Okay. Now V3 is between V2 and V4. So it's going to be somewhere here. There is no specific area, but just between these two. And then you have V5, you have fifth intercostal space, left anterior axillary line. And then V6 will be fifth ICS, left mid axillary line. Okay, so basically on a normal heart, you have V1 on the right side, V2 on the left. They're both at the fourth intercostal space. And then V4, V5, V6 will be on the fifth intercostal space, okay, along the left mid-clavicular, anterior axillary, and mid-axillary lines. Okay, now, on the other hand, if, for example, you have a patient who has dextrocardia or situs inversus, meaning the organs on the left are now on the right, okay, so it's flipped, okay, it's going to be V1 will be on the left and the others will be now on the right. Okay, I had a student, the boyfriend has only one lung and the heart is on the right side. Okay, and so I said, it's good, you could have brought him here so that we could see how it is, but that will just be the flip in the placement. Okay, so when you apply this, these are sticky. Okay, you have now your leads. This is the cable. This is the one that's attached to the machine, okay, which does not really work because it has a different port, okay, and you have this. So you will see that like this one here, it says V5. You just stick it to V5. Okay, now this like this V2, just stick it here. Okay, now this the sticky things, okay, the sticky patches, okay, you have to make sure they really stick to the skin. If it's loose, okay, you need to either wipe the area first because the area might be, the patient might have put some oil or might have put some lotion, or the patient is sweaty, and so you will not expect this to stick. It really will not stick. The only reason why it's sticking very well is because of this.
What about hair?
If there's hair, and there's a lot, you really have to shave it.
I said you gotta shave it and you have to.
What the?
Clip, right?
Because if you just clip it and it's still hairy, okay, this will not stick.
So you'll just shave it.
You just have to shave areas of that. Okay, so when you put this adhesive, so it will come in this small pack. There will be 10 of this. So you put. Okay, now do not toss this out right away, because once you're done with your EKG, put all these strips back here. Okay, put everything here. Why? So that you can count that you have all 10. Because most of the time, okay, if you don't count, you might leave one of these adhesive things on the patient's skin. And commonly, it will be the one here by the mid-axillary line. And so the patient will go home and say, there's something that's, irritating
They discharge
me.
people like that all the time. When I get
Doctor, yes,
admissions, they have
question.
all the leads on them, on
Oh
the
my
stomach. I'm like, well, let's take these off.
Can there ever be more than 10 or no, only 10?
If you have a posterior wall infarct, you have a V7, V8, V9.
Yeah, yeah. Okay.
Yes, so that is depending on like what the diagnosis is. So if you have a posterior wall infarct, then can you turn around, please? Okay. So you have a V7 here,
Right.
V8, and a V9.
Okay.
How about though? Because
I have to
sometimes
check.
I get some people on the abdomen. They'll have all these and the abdomen.
Really?
You only have like that. You'll only have 5 if you have the one on the abdomen.
Really?
Uh-huh.
Oh, okay.
So in a telemetry unit, you will not have all 12. You will have either 3 leads, or you have a 5-lead EKG.
Like in clinicals on the telly, I think I only saw like these 3.
Mm-hmm.
That's it, right?
Yes,
That's what I have.
because it allows, they get a good picture of what's happening in the heart without encumbering the patient when they need to move about.
So this is like the normal setup then, right?
That'd
There's-
be-
Yes, that's why we call it a 12 lead.
So the right arm, V1, V2, V3, V4,
One here,
V1.
So 1.
Oh, where did it
Oh, 1 was here. 1,
Oh, okay,
2,
that's
3,
what I'm like,
4,
where did
5,
1 go?
6.
Right, okay.
And then, so are these like optional?
That's
or
right arm. No,
Which
you
one?
have
The
to put
one
it.
on.
No, those
You-
are, that's part of for the upper
The ones
So
on
it'd
the
be
back
right
are
arm,
optional.
left arm, right leg,
So
left leg.
which one is preferred?
It depends. It doesn't really matter. If you don't want to, there are some cables that are a little shorter, okay? And so if you put it on the patient's leg, this one gets pulled out. Okay, so you may opt to put it here or by the abdomen. Okay, it doesn't really matter as long, whatever is convenient for you, okay? As long as, like we said, the same area. You can't have one lower than the other.
So we have to have like just a stump